Hi everyone, I'm Dr. Adrian Cole. In today's video, we're going to have a very important conversation that most men unfortunately avoid until it's too late. We'll be talking about 5 essential care tips for your penis, practical steps that every man should know and follow to ensure optimal sexual health. And if you stay with me until the very end, I'll also share a bonus 6th tip, a simple but powerful habit that can protect you from long-term damage most men have never even heard of. These tips may sound basic, but the truth is that neglecting them can lead to severe problems later in life, things like sexually transmitted infections, STIs, penile cancer, erectile dysfunction, and Peyronie's disease. So, if you care about your health, your performance, and your confidence, make sure you listen carefully. Tip 1. Keep the penis active. Avoid disuse. The very first thing we need to understand is that your penis is not just a sexual organ. It's a living organ that requires regular use and oxygenation. Just like your brain, your legs, or your arms, if you don't use it, you risk losing function over time. When a penis goes too long without stimulation or erection, the tissues inside don't receive enough oxygen-rich blood. This leads to stiffness, reduced elasticity, and even long-term difficulty achieving or maintaining erections. It's almost like a muscle that hasn't been exercised. It slowly weakens. Now, many men assume this only applies to those who are sexually active or who masturbate regularly. But that's not the case. Even men who are not currently in relationships or who for personal reasons are not sexually active still need to keep the organ active. Some patients benefit from using a vacuum penile pump, which draws blood into the organ and helps keep the tissues flexible. Others may consider pelvic floor physiotherapy, which works to stimulate blood flow and preserve erectile health. The important point is this: whether through a healthy sex life, self-stimulation, or medical tools, you must avoid total disuse, because disuse is one of the silent killers of sexual health. Tip 2. Personal hygiene, more important than you think. Now let's talk about hygiene. This might sound obvious, but you'd be surprised how many men still neglect this. Proper hygiene is not just about feeling clean, it's about preventing serious diseases. Take this statistic. In Brazil, penile cancer rates are among the highest in the world. And do you know the number 1 risk factor for this cancer? Poor hygiene. Failing to wash properly allows smegma, bacteria, and secretions to build up under the foreskin. Over time, this irritation can cause inflammation, infections, and even pave the way for cancerous changes. That's why daily washing with a neutral or glycerin-based soap is crucial. Equally important is drying thoroughly. Moisture left behind creates the perfect environment for fungal or bacterial growth. Another vital point: always wash your penis after sexual intercourse. Why? Because the pH of the vagina is different from the pH of the penis. Leaving vaginal fluids on the penis can disrupt your natural balance, leading to irritation, infection, or long-term issues. This may seem like a small detail, but it's one of the simplest and most powerful ways to safeguard your sexual health. In the next part, we'll go deeper into the remaining tips: how to avoid hidden trauma during sex, the dangers of pornography that nobody talks about, and the lifestyle habits that can make or break your erections. And of course, the final bonus tip that could save you from one of the most common causes of penile deformity. Tip 3. Be careful with partial erections. During intercourse, now let's move on to a tip that many men overlook. Having sex with a semi-erect penis may sound harmless, but in reality it's extremely risky. When the penis is not fully rigid, it becomes vulnerable to repeated microtraumas, tiny injuries that may not cause immediate pain but build up over time. These microinjuries often result in scar tissue or nodules. Once that happens, the tissue begins to harden in irregular ways, eventually leading to a curvature of the penis, a condition known as Peyronie's disease. This curvature doesn't just affect appearance, it can make intercourse painful or even impossible, both for you and your partner. And the sad truth is that many men develop Peyronie's not from a single accident, but from years of ignoring this warning. That's why you should always make sure you're fully erect before penetration. It's a small habit that could save you from lifelong problems. Tip 4. Limit or avoid excessive pornography. The fourth tip is one that I emphasize with nearly all my patients. Watch your consumption of pornography. Now, I'm not here to tell you that all porn is evil, but excessive use, especially daily or multiple times per day, rewires the brain in ways most men don't realize. Overexposure creates a condition we call sexual desensitization. Here's what happens. When you rely on high-intensity visual stimuli to achieve arousal, your brain becomes conditioned to need that constant novelty. Then, when you're with a real partner, someone who doesn't change scenes every 30 seconds or who doesn't mimic unrealistic scenarios, you may find it difficult to become aroused or to maintain an erection. This is one of the hidden drivers behind porn-induced erectile dysfunction, a growing problem in men under 40. Many patients tell me, "Doctor, I can get hard when I'm watching, but with my partner, I go limp." And the reason is that their brain has become dependent on the artificial stimulus of porn. So, moderation is key. Occasional viewing isn't the issue, it's the dependency that sabotages your real-life sexual performance. Tip 5. Lifestyle habits, the foundation of sexual health. Finally, let's talk about the big picture, your lifestyle. Your penis does not exist in isolation. Its health is a reflection of your entire body. For example, men who smoke are twice as likely to develop erectile dysfunction compared to non-smokers. Why? Because smoking damages blood vessels, and erections are 100% dependent on good blood flow. Alcohol, especially in excess, also takes a toll, lowering testosterone, numbing nerve sensitivity, and reducing performance. A poor diet heavy in processed foods, sugars, and trans fats leads to obesity, diabetes, and clogged arteries, all of which compromise sexual function. On the flip side, adopting healthier habits can dramatically improve your performance. Stay hydrated. Dehydration thickens your blood and reduces circulation. Eat clean. Foods rich in omega-3s, antioxidants, and lean proteins keep your vascular system clear. Exercise regularly. Cardiovascular and pelvic floor exercises both enhance blood flow directly to the penis. Protect your mental health. Stress and anxiety are silent killers of erections. Meditation, sleep, and relaxation are not luxuries. They're necessities. Remember this. A healthy lifestyle doesn't just prevent erectile dysfunction, it fuels stronger, longer-lasting, and more satisfying erections. Bonus tip, sleep without tight underwear. Now for the bonus tip that very few men know about, but it's extremely important. Sleep without underwear, or at least use very loose underwear. Why? Because men experience multiple spontaneous erections at night. These nocturnal erections are natural and actually beneficial. They keep the penis oxygenated and healthy. But if you're wearing tight briefs, these erections get compressed against fabric. Over time, that compression can create local trauma, leading to scar tissue and even contributing to Peyronie's disease. It sounds simple, but allowing your penis to expand freely during the night is one of the most underrated ways to protect its long-term health. Final words and call to action. So there you have it, the 5 essential tips and 1 bonus tip that every man should follow to protect his sexual health. Let's quickly recap. Keep your penis active. Avoid disuse. Maintain proper hygiene, always. Avoid intercourse with a semi-erect penis. Limit pornography to prevent desensitization. Adopt healthy lifestyle habits. And as a bonus, sleep without tight underwear. If you apply these consistently, you're not just preventing disease, you're actively investing in better performance, confidence, and satisfaction for years to come. If you found this video helpful, please give it a like, share it with someone who needs to hear this, and leave your questions below. And don't forget to subscribe, because here we talk about men's health openly, honestly, and with science-backed solutions. See you in the next video.